I was gone, the Breaking the News team got crafty and went to you to find out what's on your mind. What do you want us to dig into? Most of you had just one request. The people wanted a simple explanation of what's in the Republican health care overhaul in Congress, and you wanted to know, obviously, how it affects each of you.
So that's what we're going to do. You asked, we're going to deliver. Here are some of the biggest changes proposed in the American Health Care Act. Some of you will find this story childish. Others will see the importance of it. I hope it's the latter.
You're going to hear a lot of political and expert debate over how this bill might alter the health insurance industry for better or for worse. But here are just the facts and some big stuff in this bill going through committee in Congress right now. And I'm going to explain it using dolls. First, the mandate is gone. This means if you do not want to buy health insurance, you don't have to. And you're not going to face any tax penalty for it. Although, if you're just going to pick up insurance when you think you might need it, be careful because there are some penalties for that. Example.
Hi, I'm Jim. I'm 34 and employed. I really just never wanted to get health insurance because it's expensive. But after the Affordable Care Act, aka Obamacare, I kind of had to, or I'd pay a penalty. But if this bill passes, I don't have to buy it. Freedom.
Number 2, subsidies out, tax credits in. Basically, those discounted plans you get based on income are going to be gone. Everyone pays the full price. However, if you make less than $75,000 a year, you could get anywhere from $2,000 to $4,000 back from the Gov during tax time. How much you get, though, is solely based on your age. The older you are, the more you're going to get back.
Hi, I'm Lori. I'm 63 years old and make about $70,000 a year. If I buy a plan from the individual insurance market, I'll get $4,000 back in April. Sweet.
And I'm Jeff. I'm 27. I make about 25 grand a year. Under the same plan, I'll get $2,000 in tax credits. Woohoo!
Number 3, things that aren't changing. A couple of Obamacare policies will remain in this proposal. Insurance companies can't deny you for pre-existing conditions. And parents could still keep children up to 26 years old on their plans.
Good evening, I'm Stacy. That's a relief because I have a college student at home who I wasn't sure I could keep on my insurance. Okay, enough about me.
Number 4 is Medicaid, known in Minnesota as medical assistance. About 1/5 of the state's population is covered by this insurance. Under the new bill, Uncle Sam will continue to cover it, but they're going to put a cap on how much. So in the next few years, it'll be up to the states to decide if they want to fund any increases in costs.
Hi, I'm Bruce. I'm 40 and make about 15 grand a year, but I also save lives, which doesn't count for much these days. It looks like I would still be covered by Medicaid until 2020, but it's really unclear if the program would change after that. Stay tuned, I guess.
Finally, number 5, business mandate. That's gone too. Under the ACA, most businesses with more than 50 employees, they had to provide insurance for employees or face a penalty. That would go away.
Hey, I'm Lexi, and as the CEO of Techdoll LLC, I had no choice but to pay for insurance for my employees after Obamacare, and let me tell you, it was not cheap. Sounds like it could change, so at least I have a choice.
Took a risk. We took a swing there. Hopefully people liked the analogy there. And if I have a slight dent on the side of my head there, that's from me banging my head on my desk, reading that bill today, that 123 pages. It's basically like legislature code for what's going to affect many lives. The bill's probably going to change a few times because there is a lot of infighting between Democrats, Republicans, and Republicans about this bill. So some of those parts might change here. But that's the bill in a nutshell, and I hope people can digest that.
Yeah, there's so much more going into it that's really on both sides people are upset about that we'll have to really see how it shakes out when it goes into effect. When we see people not on health insurance that did have health insurance, how will that affect emergency rooms? I mean, lots of stuff that we just don't know yet. But I like the dolls. They were pretty cool. All right, let's move on to the other